I use, or maybe any of us use routinely, but in certain situations like sports-related massage, slapping is used to, at the end perhaps of a more sedative type of massage, to regain arousal or awake the patient. And you might see it in situations where it is a patient who is an athlete, and you have applied these techniques to relax the muscle. Now you're trying to do the opposite effect. Okay, so that basically, do you mind if I show that? Okay. Go ahead and turn green. So basically, it's slapping after you. I'm sure you've heard that if you've had a massage, someone may do that. Obviously, it's not meant to create a sedative effect. It's meant to create arousal. So, did any of you use it? I might ask.
Just when they don't pay co-pays.
Oh, okay. When you're mad at the patient. Okay, and the most probably common use of percussion is in patients that have cardio, respiratory dysfunction, and you're trying to do postural drainage. You're trying to get the fluids to move. This is a separate section of PT that is very specialized. Respiratory therapists do the same. This type of technique involves, where I was doing slapping is sort of a flat hand, but in percussion it's cupping. Okay, I'm going to have her do it on her side. But the idea is to form sort of a cup with your hands and to apply rhythmic. The whole thing about this is that you're maintaining the same speed. You're over the lung that needs to be cleared. Often this is incorporated with postural drainage. The patient may be in a Trendelenburg position. And the whole idea is to clear the lungs of, any fluid that is not supposed to be there. So, like I said, respiratory therapists have taken a large part of this type of therapy over for us. And there's also machines that apply the percussion. But let me just show you real quickly. Do you mind turning on your side towards me? And you're good. You would identify, of course, what lung you're trying to clear, and that's one thing, who teaches that part of our, is it Dr. McIntyre? Okay, well, you'll be learning this, so we're not going to emphasize it too much for the purposes of our class, but I do need to expose you to it because it's also in the realm of soft tissue mobilization. Okay, so you would identify what lung, you would make sure the patient was comfortable, and you would apply. Sounds like a horse, doesn't it? Okay, and is there any additional things you want to add for any of these techniques? Oh, shaking. I forgot about shaking.
The thorax.
Like this. Okay. So another shaking.
Is that for drainage too?
Sorry.
Is that for drainage too?
You can use it for that. Yeah. There is also another technique, and unless I'm interpreting it wrong, I forgot to say earlier about rocking. I showed you rhythmic mobilization. I didn't show you rocking. That is on page 336 in your book, figure 1124. And basically, your hands are being placed away from each other, and you're moving in and out across, and then you're moving in this direction. So the rocking back and forth in one direction, then moving perpendicularly into a different direction. You mind going in front of you? Are you okay if I? Yes. Okay, so you see that the technique would involve placing your hands in position like this, okay, and rocking. Now I would probably in this case, you don't have to, but probably to create more rhythmic and gliding motions, I would use some lubricant on my hands, definitely, especially if the patient's skin is a little bit dry, in order to be able to glide back and forth. Okay, so that's could also be rocking and then going back and forth in this direction. Okay, so that was under rhythmic mobilization, along with the traction of the arm and the shaking, and then the shaking at the tibial-femoral joint. Okay, well, it's 1:30. Should we take a 10-minute break and then have you practice these techniques? Does that sound good? Okay, thank you very much.